Millions of people pop an aspirin a day, hoping it will prevent more serious problems like heart attacks and colorectal cancer. Well, some experts agree those with a low risk of bleeding should take a pill, but others are not so sure the benefits outweigh the risk, especially if you're healthy to begin with. Well, Dr. Lianne Marks with Baylor Scott & White co-wrote an article in the Wall Street Journal this week, and part of it reads, "Preventing disease is certainly a noble goal, but consider this, evidence-based medicine is increasingly revealing harms in many seemingly safe preventative measures, and aspirin therapy is no exception." Well, this morning, Dr. Marks joins us now to talk about this controversial topic. Good morning to you.
Good morning.
So this was your very first time to write in the Wall Street Journal. And you co-wrote this article. It's very interesting because it goes back and forth with a doctor out of London, Jack Cusick, who says it's clear that aspirin can reduce the risk of cancer, but you say that there are dangerous side effects. So talk about this back and forth and what the takeaways need to be for folks at home.
I think that the most important message is that taking a daily aspirin, even though it seems like a simple, easy thing to do, can be a dangerous way to sort of pursue optimal health.
What are some of the most dangerous side effects? What are we talking about?
So some of the things I wrote in the article, and there are some additional things. So you can have bleeding in your brain, for example. So if you have a car accident while you're on aspirin, that increases your risk of bleeding overall. But the more common things we see are bleeding in the GI tract, so in the stomach, in the intestines. It can promote ulcers, for example, stomach ulcers, and it can actually cause hospitalization, and we actually see that not too infrequently. It can increase risk for gout. It can cause kidney damage if used in higher quantities. So there's lots of possible downsides.
Is there anyone who it can help, who you would say continue taking that aspirin every day?
Sure, and so this article focused on primary prevention, meaning people that have never had a heart attack or stroke, taking whether or not it's beneficial to take the aspirin. But for people who have had a heart attack or stroke, it's pretty uncontroversial that most of those patients should be taking a blood thinner or sometimes multiple blood thinners, and aspirin is often among those medications.
So if not aspirin, what should people be taking? What can they replace this with? That's the smarter choice.
Sure. So what depends what you're looking at. So for example, if you're looking at prevention of heart attack or prevention of stroke, the evidence is very clear that diet and exercise is extremely important. And so for example, Mediterranean diet has a lot of evidence behind it. And then certainly good old-fashioned exercise is extremely important. Cancer prevention, actually those same things improve the risk of cancer, lower the risk of cancer. A heart-healthy diet actually is a colon-healthy diet. So that's the thing to do. And even though it seems easier to just take a pill, practicing proper diet and exercise are extremely important.
Okay, Dr. Marks, we're already out of time this morning. Thank you so much for being here.